My name is Irma Drobness, and I'm not only a researcher at the Institute for Women's Health Research, but I'm also a grateful patient. As a 4-H kid raising dairy goats in the San Fernando Valley, I knew about the birds and the bees from a very early age. And this interest that I had in animal reproduction carried me through my graduate studies and postdoctoral studies, and also I became faculty at the University of California at Davis, studying preservation of sperm from all kinds of different animals, including exotic species and even bees, as it turns out. They do artificial insemination in bees. 26 years ago, I came to Mizzou, and I narrowed my research interest into fertility in humans. Even though I was a researcher in human fertility, I didn't pay attention to my own reproductive health. I knew that my mother and my grandmother had both had breast cancer, but it wasn't until my two sisters also got breast cancer and my third sister got ovarian cancer that I became concerned about my own cancer risk. And I mentioned the risk to my primary care physician, and she ordered a pelvic ultrasound to look at my ovaries, but then didn't continue with any other surveillance over the next 10 years. So at that time I went to a great grand rounds presentation by one of our researchers, Dr. Mark Hunter, and he was talking about how ovarian cancer isn't necessarily from the ovary, it's actually cells from the fallopian tube that become cancerous. So I mentioned to him my family history of ovarian cancer and breast cancer, and he recommended that I see a specialist in breast health. So that specialist is having me have a mammogram every year, and then 6 months later a breast ultrasound, and then go back and forth with each of those every 6 months. So he also thought that I should have a hysterectomy to remove my ovaries, fallopian tubes, and uterus, and that's to prevent ovarian cancer. Given my family history, Dr. Hunter suggested that I have a hysterectomy to remove my uterus and ovaries, and he recommended a robotic surgery, and research has developed the robot method so that people can get back to work right away after their surgery. Also, because of recent research, Dr. Hunter thought that I should have genetic testing, because there are some genes that are related to cancer risk. And so I did have a complete testing panel, and fortunately my results were reassuring. I didn't really have any of the genetic defects that are associated with cancer, but I was very happy that that research had been done and that I was able to have that testing. As a grateful patient, I have great appreciation for the research that has given me greater peace of mind and also decreased my risk of dying.